Becca, thank you. Well, this Sunday we are setting our clocks forward an hour, which means we are going to have some more daylight during the day, but it also means we are losing an hour of sleep. And of course, changes to our sleep schedules affect everyone, but a new study is showing that it can especially impact teenagers. So joining us today to talk more about that is Dr. Conway. Thank you for being here.
Thank you.
So you are an associate professor of general pediatrics at UT, but also she's the director of the university's Child and Youth Development Lab. So very interesting stuff that came out of this research here. As we approach this daylight saving time that's coming up on Sunday, tell us more about how your research, you talk about how sleep and mental health kind of intertwine. Give us like an overview of what you do and what your research is all about.
Right, okay, so I just want to also mention that I'm an associate professor at the College of Social Work here.
Great.
And we're really committed to community work.
Wonderful.
Dean Messenger is really interested in getting involved in the community and promoting health and a variety of things.
Absolutely.
So I want to mention that. So you're asking about sleep and mental health? Mm-hmm. So for our study, we looked at something called social jet lag. And that has to do with, that's the variability in the change in the sleep times that people have, particularly from the weekend to the weekday. So a lot of people will sleep in during the weekends, and then they have to get up really early on Monday morning, and that can feel like they're flying in from California sometimes, right?
Yeah.
So what we did was we looked at that in relation to adolescent mental health, and we found that 12-year-old girls who had more of this social jet lag, more variability in their sleep times during the week and to the weekday, they were more likely to have, 3 years later, to have depressive symptoms and behavior problems. So sleep is really integrated in mental health, obesity, education. It's particularly pronounced for adolescents because adolescents, after puberty, and middle schoolers, after puberty, they have this natural shift to the melatonin is secreted later in the evening, so they prefer later bedtimes and later morning times. But they have the social constraints of getting up early for school.
Wow.
So they're forced to go against their biological circadian preference. So that's why they're more likely to have the social jet lag. Adults can have it too, but they're more likely to have that. And then we found that for girls, it predicts out to their mental health 3 years later.
That's so interesting that it's specifically girls.
Well, what we think, we haven't looked at it, but what we think it has to do with puberty.
Okay.
Because girls are going to enter puberty age 12 or earlier. So that's probably part of it. Now, we may find that with boys if we look at a later time point. But what it really shows is that, schools, middle schoolers, teachers, parents really need to be attuned to girls who are having, lots of sleep difficulties or sleeping through school. The other thing that's exciting about it, I think, is that people focus on sleep duration a lot. How much sleep are you getting? But our work shows that it's not just sleep duration and how much you're getting, it's variability in the timing of your sleep and also sleep quality. So the more you shift in the times that you sleep, the less consistent you are. And when you sleep, the more difficulty you're going to have.
And briefly, if you could maybe provide some parents who are watching right now with some tips to how to make the transition a little bit easier as we head into this weekend.
Right. So one thing that's important is not just for this weekend, but this is an issue that can happen every Monday morning, right? So even if kids are on break, they're going to have difficulty when they start back after break, and adults too. So the research shows that setting consistent bedtimes, so parents, enforcing and structuring consistent bedtimes across the week is really important. Another thing, particularly for adolescents, is reducing screen time. Because, and it's not just necessarily the light, it's that when they're texting, they're texting with their friends. So that gets really even more arousing. And one of the most important things is that we all need to do is we need to have a buffer zone, before sleep, like maybe an hour before sleep. We need to dim the lights more, wind down, and have a sleep routine, get the kids like ready for bed
Yeah.
and doing relaxing
Yeah.
things like that, because you need to relax
Yeah.
to be able to transition to sleep.
Good things to keep in mind, certainly. Dr.
Yeah.
Conway, thank you so
Thank
much for
you.
stopping by. We
Thank
really
you.
appreciate it. We're going to go ahead and take a short break, and we'll be right back.